Okay, hello everyone. We are live here today on our Eye Care Business live stream. My name is Erinn Morgan. I am the editor-in-chief of Eye Care Business magazine, and thank you all for joining us. And I am thrilled to be here today with KT Overbey. Did I say your last name correctly?
It's
Overbey, or is it
it's Overbey, but many
Overbey?
say it the way you do.
Well, thank you for the clarification. And KT, it is such a pleasure and an honor to be here with you today. We are so excited about the work that you do with OneSight and everything that OneSight does for vision care and taking care of folks and their vision around the world, around the country and around the world. So thank you so much for joining us to share a bit more about that today.
Well, thank you for having me. I'm really glad to be able to join you today.
Thank you. Well, I know you're coming there from Cincinnati. I'm here
Mhm.
in Colorado. We're kind of straddling some time zones here, but we appreciate everyone here watching. Folks, if you're here watching, as we're gonna run into kind of our Q&A session next with KT, and then we are gonna have a little time for audience questions if you do have any questions. So feel free to type those questions as we go along into the comment bars, either in YouTube or on Facebook, wherever you're watching. And that will show up back here in our back end too, and we'll be able to address those if you do have them. The other thing is that we love to know who's here watching today. So I see a lot of folks here watching. So please tell us, if you will, in the comment bars, where you're from, either your name or your practice name or your location. So please let us know where you're watching from today. We're so excited to see that folks are here to learn more about OneSight and hear this good info. So KT, again, thanks so much for joining us today. We're super excited to learn more about OneSight's inspiring initiatives. Can you please tell us a little bit about the background and the history of the organization? What is OneSight's mission?
Well, OneSight is a global nonprofit that is dedicated to the idea of creating a world where access to vision care is no longer a barrier to anyone achieving their human potential. And OneSight began back in 1988 by a dedicated group of LensCrafters employees who just wanted to improve things for local students. And they started
Amazing.
out by, basically bringing recycled glasses to people. And it's just grown tremendously from there. It's grown to global charitable clinics where, we've worked in over 50 countries and serve the needs of millions of people. And we now also have sustainable programs where we set up permanent vision centers where we've now created access for over 42 million people. And
Wow.
exactly, it's really, really grown. And about 4.5 years ago, OneSight actually spun out to be a fully independent
Okay.
nonprofit.
And you said that was 4 years ago?
It was, yes.
About 4 years ago? Okay.
Mhm.
That's great to hear.
So, and we're very fortunate. I mean, Luxottica obviously continues to be our founding sponsor, but it's just, again, where we've come in the last 33 years is
Incredible.
really exciting.
And KT, you are the president and executive director of OneSight. How long have you been with OneSight now?
I've been here just about 3 years.
Oh, fantastic. That's great.
Mhm.
And did you come from other kind of, similar background?
Yes and no. So I actually spent the first part of my career in the corporate world,
Nice.
working with some large firms globally. And then I made a very conscious switch to really want to work in more mission focused work. And I
Amazing.
worked about 7 years in public health and then ended up from there coming to OneSight.
Wow, fantastic. Well, they are fortunate to have you. You have
Oh,
done
thank
such
you.
amazing things, and we're excited to, be able to help out and share more information with our readers and our viewers. So, in 2020, which is, a year none of us will forget,
That's right.
one site, your charitable programming helped more than 13,500 people, is that correct? Receive
That
exams
is.
and prescription
Mhm.
eyeglasses. So we were fortunate to be able to kind of take a tour, back in
Yeah.
October with you at one of the clinics that was actually happening in New York City. And that, even during the pandemic, you've been able to deliver this incredible care. And, I wear, obviously so many folks even more in need now than ever before. So, how did the organization have to pivot to continue to deliver that care during the pandemic? And why is OneSight's mission even more critical today?
Well, like you said, 2020 was an interesting year that none of us will forget. We were very fortunate in that many of those permanent vision centers that I mentioned across Africa and Asia actually stayed open and were able to give care
Amazing.
throughout the pandemic, which we were really, really pleased that we were able to find ways to do that. I will say our team was amazing about quickly pivoting. Obviously, the safety and health of all of our employees and patients and volunteers was always the top priority. But we're so driven by this commitment to making sure we can provide care when we can. The team was able to really quickly come up with new hygiene protocols to ensure the right levels of sanitation and social distancing and PPE. And that's actually what enabled us to get back out there in the fall, as you mentioned. So, a lot of our charitable programming did have to be put on hold. It wasn't a really good time to be moving teams of people around the world. But we were able to get back out there in the fall because, as you said, really the need, if anything, is even higher. We know so many people have been hurt by the pandemic, and people are trying to maybe retrain for a new job, and we really don't want vision to be a barrier in any of that.
Absolutely. That's pretty incredible. I imagine that was a lot of work, to be able to pivot and really kind of have all those protocols in place, but so obviously that passion was still there, to help
Mhm.
everyone, and even more so in such a time of need. So we know that you recently held an really amazing vision clinic in Cincinnati that served over 600 people. Can you please tell us a
Mhm.
little bit about that specific initiative?
Sure. So it really was fantastic. We were really honored to partner with the Anthem Blue Cross and Blue Shield Foundation. And, because of their sponsorship and support, we were able to see, as you said, over 600 children and adults. And what was really remarkable about that is of the patients we saw, 93% needed glasses. And,
Wow.
that's right here in our backyard. So,
And they didn't have them, right? So it's, or
no,
they didn't have up to date, so it's just incredible. I mean, that's a
yeah.
huge percentage.
The need is
Yeah.
real, that's for sure.
Yes. So when you do a clinic like that, where is it? Where, I know in New York you were kind of at a community
Mhm.
center or something like that. Is that kind of the typical venue for
Well,
clinics?
typically, yes. This clinic, we actually were, again, this was about pivoting and being creative. Because we couldn't necessarily bring as many people together in one central site, and we had
Right.
restrictions with schools and things like that, we actually approached it with a number of different solutions. So we do have a mobile van that we use for some clinics. We actually brought that to a couple of the schools so that we could just come directly to them for
Oh,
one
that's
day.
great.
And then in other places, we were working with partners who, again, were able to help us identify those who were most in need, whether it be homeless or people who were trying to, had lost jobs. And so we had a couple of other locations where we were able to bring
Sure.
people together and get the care they needed.
That's amazing. Wow, that's just an incredible undertaking, really, to have all of those outlets to be able to reach folks. So, can you I was, just learning a little bit about OneSight's online vision check. So
Mhm.
is can you tell us a little bit about that? Is that a new thing as of last year?
It is. It is. So we created that about a year ago. Right now, it was last April, and I'd say it's another great example of how we pivoted to try to continue to deliver care. Basically, if you recall, about this time last year, everything was shutting down. Most schools were
Right.
moved to remote learning. And we realized very quickly that for students who might already have an undiagnosed vision problem, and we know that even in this country, 1 in 4 do, that there were so many challenges already to learning that we certainly didn't want vision to be yet another challenge for them. So we developed this online vision check that is a very easy tool that parents could use with their children or for themselves, frankly. It in no way replaces a proper eye exam, but rather it was just an easy tool for them to be able to see if maybe vision is an issue for them or for their children, and hopefully encouraging them to go see an eye doctor when it was safe to do so.
Right. That makes sense. So is that up on your website?
It is. It is. It's been up there this year, and we've had well over 20,000 people
Oh
use
my
it to
gosh,
actually test their eyes.
that's
So
amazing. So great, you can track it. And that's, I'm going to type this into the comment bar for folks to have that as a resource, but it's www.onesight.org.
that's correct.
Okay, great. All right, folks, if you're watching, I just typed that in the comment bar, so you can feel free to click on there to check out the online vision check and learn a little bit more about OneSight too, if you're interested there. So also in 2020, and I'm really curious to learn about these as well, and I know you mentioned this before, OneSight opened 24 new sustainable
Mhm.
vision centers, and that gave access to affordable vision care to 7.3 million people. And I guess you're now at a total of 195 of these vision centers. So, I mean, what an amazing, incredible initiative. Can you, that's like in addition to everything else that you do. So, can you tell us just a little bit about these centers and how they
Sure.
operate? And, yeah, who they serve?
Well, these centers are really amazing, and as I said, we've got a long history in providing charitable care to people, and obviously we will continue that because we know that there's a lot of urgent needs. But about 8 or 9 years ago, we also started looking at what would be a long-term solution to vision care gap. So we know that 1 in 7 people around the world need access to care and don't have it. Which, for
Amazing.
perspective, that's 1.1 billion people. And
Jeez.
so we started looking at what would be sort of an ongoing long-term solution for all of those millions and billions of people. And the way our sustainable programming works is we actually go in and we partner with others. It's often the government to set up permanent vision care centers in a location where there's currently no care. We train locals to in whatever skills are needed, whether that's sponsoring them to gain the clinical skills they need or manufacturing skills or just running an optical retail business.
That's
And
amazing. So that's
then
providing some local
it is.
jobs.
We've created over 600 jobs actually in the last eight
Wow.
years. And then, as OneSight, we provide all the training, we provide the inventory and the equipment, and we get them up and running. And then once they're running to a point where, the revenue from sale of glasses, obviously we make sure that they're affordable for that community. And once the training's in place, we can step back and we still support sort of from a consultative basis. But what we leave in place is an ongoing care center that is providing care for that community by that community. And
That's
as you
amazing.
mentioned, we certainly had challenges last year. A couple of our vision center openings did get delayed because we needed to figure out a way to do that training and the opening
Sure.
in a safe way. But again, I can't say it enough. Our team is amazing and they found ways to do it. And we were able to open those as planned. And really,
Incredible.
as we look at this year, we're on track to open 25 more. So.
That is an incredible feat. Well, congratulations on that.
Oh,
And
thank you.
what an accomplishment and what a boon to those communities. So where are most of them located, or are they kind of all over the place?
So we have vision centers today in 10 countries around the world.
Wow.
I would say most are in Africa and Asia, although we
Okay.
actually have centers here in the US,
Okay.
school-based or community-based centers that provide care for people who, maybe can't get care in their community otherwise.
Right. Exactly. That's fantastic. Well, thanks for that info. Really great to know about that initiative. So many exciting things going on at OneSight. Can you tell us a little bit about what's on tap for 2021 this year? We're
Sure.
already, partway through.
Exactly. It's going fast, right? But
It sure is.
so again, 2021, we came into the year knowing we were probably still going to be operating in a little bit of volatility, but for us, we keep looking at how do we make sure that we can broaden our impact and be as effective as possible. So I just mentioned, we do have plans to open another 25 vision centers. Those are primarily across Africa and in China. And that's going to open up access to, another several million people. But we're also back out providing charitable programming, as we were talking about before. And, it's interesting. We know that there's still restrictions on travel. So we are really focused on how do we provide that care at the community level. So across the US, we'll be working in a number of communities where we've seen a lot of people be hurt. We're back to working with in a number of Native American communities where we have long-standing partnerships. But also, we're planning on working in South Africa, China, Australia, and we're really hoping to get back. We've been providing care at the border between Thailand and Myanmar for several years, and we're still hoping to be back there, but it'll be determined by COVID.
Sure, no doubt. Well, that's wonderful. Fantastic initiatives on tap for this year, even just the rest of the year. Only 8 months left to go now.
Hard to believe.
It is hard to believe. So, our viewers and our readers of iCare Business, I see we're getting more and more viewers here hopping on. So I'm really grateful for everyone here. If anyone has a question for KT, please feel free to type that into the comment bar. We can get to that in a minute here. I have one last question for you before we wrap it up. But thank you all, for joining us, and please feel free to type your questions into the comment bars if you have any. So, our viewers and our readers for iCare Business, they're opticians, they're optometrists, they're office staff, so many folks and so many practices today, I know, especially, are really looking to give back and to help out, whether that's in their community or beyond, and help around the world. So how can the independent eye care professionals today become part of the inspiring work done at OneSight? Where can our viewers, and is there a place for our viewers to go to learn more about that and how they can become involved?
Absolutely. We really welcome involvement from, everywhere in the industry. And for anyone who's interested in learning more or in getting involved, they can simply go to www.onesight.org/engage.
I'm going to type that into the comment bar here so everyone has that. Fantastic. So there are some resources there and information there about becoming involved.
Great.
That's great.
Mm-hmm.
Fantastic. So, and there are ways, is the involvement kind of more on a community level in their own community, or it's broader beyond that?
It's broader.
It's for all of the above.
It's all of the above. Exactly.
Okay.
For us to continue to provide as much care as we can for those who are truly in need, obviously we can't do this alone. And
sure,
we are committed to very high standards for the quality of the care we deliver. We do, as I mentioned before, we have wonderful partnership and sponsorship from Luxottica, but we also work with other independent eye care providers, and we do really welcome that involvement.
That's great. Wonderful to hear. Well, I can't tell you how much I appreciate you joining us, KT, today and sharing this information. It is so important, this work. And, I know you've shared so many statistics with us. Obviously, there's such a tremendous need around the world for folks that just don't even have access to vision care, and certainly not prescription eyewear, and can't afford it, don't have access or can't afford it. And especially in the wake of COVID, it's become much, much harder for those folks as well. So thank you for everything that you do, and thank you for everything that OneSight does. And we're very proud to be able to have you on here and to share this good information with everyone. So thank you for your time today.
No, it's my pleasure. Thank you so much for having me join you today.
It was wonderful. And hopefully we'll see you out there sometime in the future at one of the clinics, and we'll be able to join you live.
We would love that.
Fantastic. Well, thank you so much. Thanks for everyone joining us, and we wish everyone a great day. And thanks again, KT.
Thanks,
Take care.